This is an admission H&P. It contains 148 words. To figure out what it's worth, we need to figure out the level of care by taking apart the history, the exam, and the medical decision-making, and plugging that information into this table, which shows the documentation requirements for admission H&Ps. For these encounters, all three key components are needed. You can use either the 95 or the 97 guidelines. In this case, the 95 guidelines work out better for the doctor. Here's the table we use to figure out what level of history has been recorded. First, we do have a valid chief complaint. Then, starting with the HPI, we see the doctor says the patient presents with a 2-day history of severe intermittent shortness of breath associated with worsening lower extremity edema. Here we get credit for the duration of the problem, the severity, the timing, and also associated signs or symptoms. This gives us 4 HPI elements, which is what you need to qualify for an extended HPI. So now we know we have an extended HPI. The next step is to check the PFSH. Looking at the PFSH, you see that at least one element from the past medical, social, and family history is recorded, which means we have a 3 out of 3 PFSH. The next step is to check the ROS. Looking at the ROS, the most clinically relevant systems are documented. Along with the accepted shortcut, all other systems are viewed and are negative. Both the 95 and 97 guidelines do allow the shortcut. Unfortunately, some Medicare carriers do not, so check with your local carrier first. I practice in Connecticut, where the shortcut is allowed, so here we get credit for a full ROS. So going back to our history table, now we know we have an extended HPI, 3 out of 3 components of PFSH, and a complete review of systems. That gives us a comprehensive history, so now the first key component is known. The next step is to check the physical exam. Looking at the exam and using the 1995 guidelines, we see that information is recorded about the constitutional system, the eyes, the respiratory system, the cardiovascular system, the GI system, the musculoskeletal system, the skin, and the psychiatric system. This gives us 8 organ systems, which means this qualifies as a comprehensive physical exam, so now the second key component is known. The last step is to check the medical decision-making. Looking at the medical decision-making, and starting with the problem points, here we see we have a new problem for which further workup is described. That means it's worth 4 problem points. We also have another problem which is also new, but for which no workup is described. That means it's worth 3 problem points. That gives us a total of 7 problem points for this encounter. The next step is to check the data points. Looking at the data points, here we get 1 data point for reviewing labs, 2 data points for eyeballing the EKG, 1 data point for looking at the chest X-ray report. That gives us a total of 4 data points. The next step is to check the risk. Looking at the risk, the pertinent part of the risk table is the high-risk part, because here we have a severe exacerbation of a chronic illness. I know that because it's documented right here. So this is definitely a high-risk encounter. So we have 4 or more problem points, 4 data points, and high risk. So here, even though only 2 out of 3 dimensions are needed, in this case all 3 dimensions clearly point toward high complexity medical decision-making. So now this key component is also known. Going back to our documentation grid, we have a comprehensive history, a comprehensive exam, and high complexity medical decision-making, which means that this note would qualify for the 99223 level of care, otherwise known as a level 3 admission H&P. When you put it all together, now we know 3 out of 3 key components are needed, and here we have a qualifying history, a qualifying exam, and qualifying medical decision-making. So here the 99223 level of care took us 148 words to complete and is worth $194, which works out to $1.31 per word, which is very efficient documentation. If you want to learn how to take apart a note like this, consider signing up for one of our web-based E&M coding curriculums. We offer several different subscription options to match any practice pattern. We also have a CODA curriculum, which includes up to 33 AAPC CEUs for only $99. If you need E&M coding education from multiple providers, ask about an E&M compliance web portal, which provides trackable and verifiable E&M coding education for multiple doctors.